Navigating Fruit Choices for Senior Wellness, a comprehensive guide based on insights from Dr. Evelyn Reed at the Evergreen Health Institute. As people age, dietary needs evolve in response to physiological and metabolic changes in the body. Dr. Evelyn Reed, a respected nutritionist at the Evergreen Health Institute in Willow Creek, has long studied the intricate relationship between fruit consumption and senior wellness. Her findings highlight an essential but frequently overlooked concept. While fruits are generally heralded as nutritional powerhouses, certain fruits may actually do more harm than good for seniors when consumed in excess or without consideration of their specific health needs. According to Dr. Reed, many fruits that are perceived as healthy can inadvertently lead to issues such as joint pain, blood sugar instability, swelling in the legs, and decreased mobility. She emphasizes the importance of making strategic dietary choices to help seniors maintain leg strength, reduce joint discomfort, and retain independence as they age. The biological realities of aging and diet. As individuals enter their golden years, their bodies undergo several inevitable changes that can significantly impact how food is processed and utilized. Among these changes are slowed metabolism. As metabolism slows, the body becomes less efficient at processing sugars and fats, decreased muscle mass and bone density. These declines contribute to reduced physical strength and stability. Changes in circulation. Blood vessels become more fragile, and circulation to extremities, especially the legs, can weaken. Joint wear and tear. Years of movement and strain take a toll on joints, which may result in arthritis, stiffness, and decreased range of motion. With these changes, the foods that once seemed harmless or beneficial might begin to have unintended negative effects. Fruits high in sugar, acids, or certain enzymes may worsen inflammation or cause discomfort in aging joints. Fruits seniors should approach with caution. Reed outlines several fruits that, while nutritious for the general population, should be consumed sparingly or with care by older adults due to their potential to aggravate common age-related health concerns. 1. Piña pineapple is beloved for its juicy sweetness and tropical flavor, but it presents specific risks for seniors. It contains a high concentration of natural sugars and citric acid, both of which can cause sudden blood sugar spikes. Fragile blood vessels lead to swelling, fatigue, or stiffness in the legs. Furthermore, pineapple contains bromelain, a digestive enzyme that can interact with certain medications, particularly blood thinners. This can lead to bruising or prolonged bleeding, making it important for seniors on such medications to consult their physician before regularly consuming pineapple. 2. Bananas are often marketed as an ideal snack due to their convenience and potassium content. However, for seniors, they can present issues such as high glycemic load, which causes rapid increases in blood sugar water retention, contributing to bloating or swollen legs and ankles. Increased inflammation in already sensitive joints. While not entirely off limits, bananas should be paired with high fiber or protein-rich foods to blunt their sugar absorption rate. 3. Grapes. Although small and seemingly harmless, grapes are densely packed with fructose, a type of natural sugar that is primarily processed by the liver. Excess fructose can be converted into fat or uric acid, lead to elevated uric acid levels in the bloodstream, trigger or worsen gout symptoms, particularly in joints such as the toes, ankles, and knees. Older adults with a history of joint pain or gout should monitor their grape intake closely. 4. Watermelon. Refreshing and hydrating. Watermelon is a summertime favorite. However, it possesses a high glycemic index, which means it causes swift and significant spikes in blood sugar, promotes systemic inflammation, particularly affects areas with poor circulation, such as the legs and feet. Even though it's hydrating, seniors with diabetes or circulatory issues may need to limit portion sizes. 5. Orange. Uric and vitamin C, and popular for boosting immunity. Oranges can be problematic for older adults due to high citric acid content, which may irritate inflamed or arthritic joints. Natural sugars that can destabilize blood sugar levels. Higher potential to increase overall body inflammation when consumed. Frequently alternative sources of vitamin C like bell peppers or kiwi, may offer similar benefits with less joint irritation. 6. Green apples crisp and tart. Green apples are often viewed as healthier than their red counterparts due to lower sugar content. However, they contain malic acid, which can cause stomach discomfort in individuals with sensitive digestive systems. Contribute to joint irritation, particularly in the hips, knees, or thighs. While not inherently harmful, seniors should be aware of how their bodies respond after eating green apples and consider peeling them to reduce acidity. 7. Mango is frequently referred to as nature's candy. Mangoes are extremely high in sugar. For seniors, this translates into dramatic glycemic fluctuations, sharp rises followed by sudden crash epics in insulin, leading to systemic inflammation symptoms such as tingling, swelling, or burning sensations in the joints. Toes. Managing diabetes, arthritis, or inflammatory conditions may benefit from limiting mango consumption or avoiding it altogether. Fruits that support senior health and mobility. Fortunately, Dr. Reed underscores that many fruits offer tremendous health benefits without the drawbacks. These fruits provide essential vitamins, antioxidants, and anti-inflammatory compounds without contributing to joint discomfort or blood sugar imbalances. 1. Berries. Blueberries, raspberries, blackberries. Berries are nutritional gems for older adults. They are low in natural sugar, shy, and anthocyanins, which fight inflammation, rich in fiber, supporting digestion and stabilizing blood sugar. Beneficial for improving circulation and joint function. Incorporating a handful of berries into breakfast or as a snack can provide a powerful boost to vascular and joint health. 2. Cherries, especially tart cherries, are known for their potent anti-inflammatory effects. They are particularly helpful for seniors suffering from gout, arthritis, or joint discomfort. Studies suggest that regular consumption of cherries can reduce uric acid levels in the bloodstream and diminish the frequency and intensity of gout. Flare-ups. 3. Papaya is an excellent digestive aid thanks to its enzyme, papain. For seniors, papaya offers soothing properties for the stomach, enzymatic support for protein digestion, natural anti-inflammatory effects, which alleviate joint stiffness and swelling. It's also rich in vitamin C and beta-carotene, making it a strong ally in immune health. For pears are ideal for seniors seeking gentle sweetness without overwhelming their systems. They have a low glycemic load, are high in soluble fiber, which helps regulate blood sugar and cholesterol. Contain antioxidants that reduce inflammation. Pairing sliced pears with a handful of nuts can create a blood sugar-friendly snack that also promotes joint stability. Practical guidelines for seniors choosing fruit. Reed advises seniors to adopt several strategies when incorporating fruit into their daily routine. Moderation. Even the healthiest fruits should be consumed in controlled portions to avoid sugar overload. Pairing with protein or fat, combining fruit with foods rich in protein or healthy fat such as Greek yogurt, almonds, or cottage cheese can slow sugar absorption and stabilize energy levels. Timing matters. Eating fruit earlier in the day may allow the body to utilize the sugars more efficiently, reducing the risk of nighttime inflammation or blood sugar crashes. Monitoring individual responses. Seniors should pay attention to how their bodies react to specific fruits. Joint pain, fatigue, or bloating after fruit consumption could indicate sensitivity. Conclusion. Smart fruit choices for a healthier tomorrow. Aging doesn't have to mean discomfort, reduced mobility, or chronic joint pain. By following evidence-based guidelines and paying closer attention to fruit choices, seniors can significantly improve their quality of life. Dr. Evelyn Reed and the Evergreen Health Institute continue to advocate for tailored nutritional strategies that align with the changing needs of the aging body. By being proactive and selective, older adults can enjoy the flavors of nature without compromising their strength, mobility, or comfort. The right fruits not only nourish the body, but also empower seniors to stay active, independent, and vibrant throughout their later years.